So doctor, please tell us exactly what a Pap test is.
So a Pap test is a test that we do in the office looking for signs of cervical cancer. So it's usually part of a pelvic exam, and what the doctor does is that we look at your cervix, and we put a little brush into the cervix, trying to get some cells that then are sent off for analysis.
So this is what happens when our legs are on those stirrups, and
yes,
and you're out there doing, and you're down there doing business.
Yes.
So that's obviously very important. But how often do we need to be getting Pap tests? I think that's the question. During commercial break, I was telling you I want one every year, but really sometimes you don't need one every year. So we have this graphic. Can you talk to us a little bit about that?
Yes. So typically we start at age 21.
Okay.
And it's every 3 years in the 20s.
Every 3 years.
As long as the Paps are normal. Once you hit age 30, it can be every 5 years if the doctor is checking for, if the doctor is doing a Pap and checking for HPV.
So every 5 years?
It can be, if it's normal.
If it's normal, okay. Now, after 65 and older, you basically don't need?
We typically stop at age 65 unless the person has had a history of abnormal Paps. But generally at age 65, you're done.
Now, when you have HPV, now that number obviously increases. You probably want to see a patient every year.
Yes, and that's where some of the guidelines get a little convoluted, but yes, typically it's a lot more frequent screening, or you might even need something a little bit more advanced if you test positive with HPV.